Go ahead, Cynthia.
Well, Linda Montgomery asked a question here that is, can cigarette smoke cause lead poisoning in children? And I'm wondering if she means like prenatal cigarette smoke or a direct exposure to children or children who are actually smoking themselves. I don't think there's lead routinely in a lot of cigarettes. So I'm not sure that if you smoke a cigarette or you're just breathing in the environmental tobacco smoke that you'll get lead poisoning, although depending on where you put your cigarette down and then pick it up, that would be like hand-to-mouth behavior that we see in infants and toddlers that does give them lead poisoning. But I don't think I've ever seen anything reported on whether the cigarette smoke or smoking directly causes lead poisoning in children. So that's a good question.
I see a comment from Alan Johans who said there was a paper from APHA earlier this year that does show lead in cigarettes.
There you go. That's more than I know. So thank you, Alan.
Okay, Linda was saying she was asking about environmental smoke from cigarettes. I wanted to just mention a little bit on the last example that MSA raised about the siting of child care facilities. Because one of the reasons we focus on that is what I think there's a gap is that child care facilities are under land use and zoning codes are treated as businesses, but I think we all agree that a child care facility is a little different than a lot of other businesses. And that's why when the state of Connecticut generated this guidance on the siting of child care facilities, we thought that was a very helpful tool. Now they are eager to share it with other jurisdictions, and I think we would be delighted if there were jurisdictions, for example, who formalized it. But even if you don't formalize it, it would be a helpful resource just for guidance in those who are going to be opening a child care facility, for example.
We see there's a question from Stephanie about whether lighters are tested for the presence of lead. At least I'll speak from my standpoint here. As far as I know, at least in the last 12 years or so, I think that's the first time I've ever been asked that question. So unfortunately, I can't speak to that. I don't know if Cynthia or Carol, if you know, but certainly we will. I'm very curious. We can look that up and get back to you on that. But it's a very good question considering the good amount of.
Yes, and there are so many consumer products out there, and many, it is very difficult to test all of them. We can speak from our experience with what the kind of products we follow under our Equal Healthy Child Care program, in that we find lead in many products. For example, I believe it was Consumers Union tested a lot of holiday lights, the kinds of light cords you plug in, and found that some of these holiday lights had very high levels of lead in the cord because lead is often found in vinyl products. And when the Consumer Product Safety Commission was asked why these holiday lights were allowed to be sold on the market, even though they violated the law about the amount of lead that's allowed in children's products, they said these are not children's products, and they did not expect that children would be playing with them. So, in a lot of ways, I think you need to assume that products that are out there are not necessarily assumed to be children's products or assumed to be safe for children, unless they fall under that CPSC definition. And we do see a lot of products coming in from overseas that do have lead or cadmium in them. And we got a follow-up from what the question about lead in cigarettes, that was a paper at APHA. We don't have a more specific citation from that, but that is certainly something that we can track down if you want to follow up with us later, because that is definitely something that we would want to know about.
You're asking about whether the Consumer Product Safety Commission would be helpful to contact. I would think that that would be a good place. And again, just echoing what Carol's been saying, we know that there are still lots of products that I would not be surprised. I would say start there. I wouldn't be surprised if, again, whether they'll be able to speak or not specifically to lead exposure is the question. And I think that we recognize there are still lots of loopholes, lots of questions, even in how our consumer products are evaluated, that still have some room for growth in looking at these exposures one way or the other.
There's a question from Rebecca Ruggles about, do we know of municipal zoning codes that have addressed safe siting of child care facilities? Because there are so many municipalities and so many jurisdictions, this is something that is very difficult for us to track. So what we have looked at are state level licensing requirements for children. Where, if anyone is aware of such zoning codes, we would be delighted to know those and to share that information. How are a majority of parents being educated about child environmental health concerns, and what suggestions do you have for improvements? Nsé or Cynthia?
Yeah, I'll jump in to start. I think this is a fantastic question. I think parents receive their information in various forms and in various sectors. I think, quite frankly, a lot of parents tend to get information, even educational information, through their school system and or communities through opportunities that come up. In particular, I know that the Children's Environmental Health Network started off 20 years ago training healthcare providers. So while we're still in the case where nurses have a standardized environmental health curriculum that they are given and tested on, throughout their professional development, many are, and many more are trained now than 20 years ago in considering how the environment affects, their patients. So many providers are inevitably giving information through the well child visit, and hopefully it's the well child visit, not when a child is already sick, which of course is secondary prevention. And then there are a variety of advocate organizations like ourselves and many other organizations. I mean, we were one of the first 20 years ago. Thankfully, there are a lot more organizations, either their primary focus or a subset of their focus is dealing with children's health in some way, shape, or form, which is also fantastic. And working at the community level and the state level is just as important as the federal, if not more. And then I'll also mention what's called the Pediatric Environmental Health Specialty Units. They're located in every region of the country. They coincide with the EPA regions. And ours here, for example, they're usually affiliated with a hospital center and or academic setting. And they have pediatricians that are co-directors or directors of these. They have public health trained case managers that are on staff. These are very, very small shops. They might be one staff member and the pediatrician or a couple pediatricians that help to direct the work, or maybe one or two. And on a very, very slim budget, they do everything from training, again, of healthcare providers or other members of the community. They work on translating of the science, a little bit of what you've heard in the beginning of this presentation into, okay, how do I now translate this science into decisions that I can effectively make for my family and my various sectors. If I'm a child care provider, for my center, if I'm a healthcare provider for my practice, and so on. So they're a wealth of resource. I highly recommend them. Again, there's one in every region. They have a 1-800 number, so you can literally Google in Pediatric Environmental Health Specialty Unit or the acronym. And you can come up with a map, a U.S. map of where they're located. You can find out where you are, and then it will give you websites and resources on their websites. They have topical fact sheets, but they, in many cases, go out into the community as well, either when asked or when they join already existing summits, conferences, workshops, to also spread this information on environmental health and children's hazards.
This is Carol. I would also reiterate what Nsé said, is that the PACEUs are very, very small. I don't know how they are able to do as much as they do with their small resources. And they do generate a lot of really helpful information. But I would also step back a little bit from that question about how are parents being educated, just for, I think for us to reflect that the field of children's environmental health is relatively new. And certainly way back when I was in high school, these concepts were not imagined. They were not imagined in colleges. So one of the things that NELIC has worked to do, for example, is to get these concepts involved in board certification of pediatricians, to get this into nursing curricula. So there are ways we're trying to work to educate healthcare professionals, health and medical professionals, on this issue. And for example, we're upgrading training modules for healthcare professionals that we hope to be available in, I don't know, 6 months to a year. But through our EcoHealthy Child Care program, we also have generated a lot of material aimed at the general public. The program focuses on the child care setting, but all the materials are relevant and can be applied in a home setting as well. And that's one of the reasons why we created this child care program, is because we know that the child care setting is a very important one because of the very, very young age and the vulnerabilities of the children in that setting. And we also hope that child care providers transfer this information to parents as well. So again, you can go to our website, to our EcoHealthy Child Care program. There are 16 different fact sheets that can be downloaded for free on different topics. There also is a checklist that can be downloaded for free for a child care provider or a parent to go down the list of, here are some things where I can make practical changes, I can make more informed choices, and I can get educated about some of the common hazards out there and things that I can do to minimize children's exposure to them. But we have a long way to go in educating the general public and educating the professionals who are kind of the credible sources of information for a lot of people in the general public. And I think that's a very, very long answer to a question. There's a question about, what do you think increasing breastfeeding initiation and duration will help to mediate some of these concerns? Now, Cynthia?
Yes, hi. I just needed to unmute myself. I actually think increasing breastfeeding will mediate some of these concerns. I believe what we're studying in my laboratory is the way nutrients actually can neuroprotect the central nervous system from some of the effects of different toxicants. So breast milk has never been fully characterized for everything that's in it, both in terms of its nutrients and in terms of what potential toxins may be in it. But I still think it's the best thing to feed babies, and I believe that it does prevent some of the effects of environmental toxicants. So that would certainly be a place for some secondary prevention, is to increase breastfeeding. I don't know if anybody else has opinions on that.
Great. Are there any more questions? If you have questions, you can send them via our chat line. I wanted to move ahead. If I may provide, the question is, the immunological response that breast milk may provide to help remediate environmental toxins. If I'm summarizing the question properly. Cynthia, does that?
Yeah, I think that's also an important reason why breastfeeding is the best. And even if you go to donor breast milk, usually it's pasteurized, which kind of destroys some of the immunologic properties of breast milk. So it's actually breastfeeding and not just breast milk that can mediate some of the effects of environmental toxins.
Oh, wow, fascinating questions. I am going to move just to a little reminder slide for myself that at the end of this webinar, you will be, everyone will get an evaluation. Just a few brief questions. We'd really appreciate your assistance in answering the questions and helping us do better. We appreciate your patience with any technical glitches as we are learning about this technology for us. And we also are planning to do more webinars, and so please stay in touch with us, and we will get information about future webinars. Again, we want to make clear that this webinar is made possible through the generosity of the Centers for Disease Control and Prevention, but that this is not necessarily representative of the CDC's views. So I think with that, we will close. And here is our main website and our main phone number. We appreciate all of you taking time out of your busy schedule in joining us, and we look forward to hearing from you and working with you in the future.
Carol, can you hear me? Can everyone?
Yes.
I just wanted to mention that the slides will be available. We're actually going to be emailing them out to all participants, and then they'll be up on our website. So you'll get that link. Well, you'll get the link to the uploaded presentation.
Any other comments or questions? Then we will close out this webinar. Again, thank you so much.